Okay, very good. Very good. Please, everyone, please round of applause. Then, you have seen many of them simply are watching movie. Nobody never take the notes. Everyone having note and pen. Okay, simply are watching a movie. After watching movie, can you able to direct any movie immediately? Any movie? No. Then, similarly, simply are looking the screen and being you do not improve your skills. But please, your point of view, please taking notes. Some important points. Fine. Yes, any topic is missing. Yeah, please pass the mic to it. Again. Yes, that is very, very important. HR in agriculture. Okay. Then, initial conditions, irrigation, fluctuations. Sorry. Okay. Thank you. Thank you very much. The best. The best. Okay. Today's topic is healthcare. Today's topic is healthcare. Yesterday we discussed agriculture topics. Today we are going to discuss healthcare. Now we are going to integrate AI and IoT through healthcare department. Healthcare department means full medicals. Correct? Full medical departments. Okay. See, nowadays the information pattern in medical field in ECU department you can find many inventions. Okay, lot of things from they started from a X-ray, correct? They started the invention from X-ray, lot of things. X-ray scanning, ultra scanning, lot of things. So the healthcare department mainly we are going to focus and how we are going to implement. Okay, we will deal with artificial intelligence. IoT device. So for example, wearable devices, sensors, IoT device. What are the wearable sensors are there? Wearable devices. Watch. So maybe everyone you are using the which one? Smartwatch. Right. In the smartwatch, what are the applications are there? What is smartwatch? You are wearing smartwatch, right? Sorry, heart rate. Heart rate. Okay. Right. Steps, walking steps. How many steps you are today? Walking. Right. Next. Sorry. Okay. Oxygen level. Okay. Right. What I? It will display a temperature, body temperature, body temperature. Humidity. Okay. So lot of things. So lot of applications are included in the wearable devices. Okay. So those devices collect the real-time patient data. So going to here the devices on a patient. Okay. That devices is going to handle the data. A will be analyze this data to predict health risk. So A is going to predict the data. So IoT device always is going to the information from the environment. Okay. So predict health risk, support diagnosis, and assist decision making. So A is going to predict the final decision making. And together they create small health services. So if you are going to combine both, okay, the health services is going to become a small. Fine. Examples. For example, what are the optimize your feedback, human being? Yes. And then medical imaging. Google Health. Now you see Google Health. What is the Siemens? What is the Siemens? It is a family company. Nokia Siemens, do you know? Nokia Siemens. Yes. A detects diseases like cancer and pneumonia from remote patient. So nowadays, patients who need to totally don't need to visit the hospitals. Patients who need to don't need to visit the hospitals. From the remote place, patient can able to monitor. Okay. From the from patient home using IoT devices. So implementing IoT devices. For the outcome of the first one, yes, you can earlier getting the yes, second one. Yes, patient monitor. So you can monitor to yes, hospital visits. Patient wants to go to hospital, one of my is for the national one. We have to visit them. Father, so father, what to the we can take this very fast. Now, we want to work together. As we discussed, discuss it, you can say we are going to discuss. So, smart ICU systems. Have you seen smart ICU systems? But what are the facilities on there? Smart ICU systems. Smart ICU. Have you seen any hospital? Even ICU also, it is smart. They make become smart. All the things are digitalized. All the patient details, everything will be digitalized. No need to enter into the any into the ICU. Fine. IoT monitors track patient vitals. AI predicts complications early. And then remote patient monitoring. It's also patient monitoring. Home-based sensor data. Home-based sensor data. AI predicts doctors of concerns. So automatically the sensor will be fit into the home. Okay, that sensor will be detect the different people. Not only single. Okay, it is going to the each member of the family. We are going to analyze with the collect the data and send to the doctors. So the doctors can easily find. They can easily analyze. They can easily analyze their family members. Emergency care. Complex sensor send patient data to hospital before the arrivals. For example, some accident happens. Okay. The ambulance having all the device will be connected to doctor or hospital needs. Automatically the patient details will be sent to the where. Before reaching the patients to hospital, automatically will be sending to the hospitals or doctors. So the doctors they will be precautions will be maintenance. The first thing everything will be maintained. What is the output of this outcome? Faster medical response. Reduce to medical errors. So we can avoid the medical mistakes. And then better patient monitoring. We can monitor the patient emergency care. And then improve the clinical decision. Further, how we can improve the our clinical, how we can improve the hospitals. Hospital is very, very important. You know, fine. Next one, benefit. What are the benefit we can get it? For examples, have you seen this one? What is this, guys? X-ray. What type of X-ray? What type of X-ray is visible to everyone? Yeah, please check it. Please look at and let me know what type of X-ray. The X-ray is going to identify the cancer disease. Okay, the X-ray is going to identify the cancer disease. It is earliest stage cancer from X-rays. Okay. Smart watches monitor heart rate and oxygen. So you are building your smartwatch, right? You're going to monitor your oxygen level. Okay. Online consultations and home online. So we can do for online consultations. They help doctors choose better treatments. They can give better treatments. Okay. Sorry. What are the changes? For example, I'm going to connect with my own device. Okay. For example, I'm going to connect my own device to some home system. Okay. Then home and some hospitals. What are the challenges? You're able to identify what are the challenges? Okay. Training in cloud. Then network issues. Okay, user interface. We need to create the dashboards in the okay. So, what are the challenges are there? I have embedded with the sensor. Okay. The sensor is going to send the data to hospitals. So what are the challenges? Is there any other challenges? Accuracy, The data should be sent to accuracy. Data never detect anyone else, correct? Maybe the another person maybe they is going to detect the data, maybe going to modify the data into detect the data. Exactly. Disruptions. Okay. We should avoid the disruption and noise. We should avoid the fake data. Then these are all the challenges when you are going to implement your applications, when you are going to integrate IoT device to another device to the remote place. Lot of challenges. So you need to point out that challenges and just avoid that challenge. When you are going to implement any projects, first we need to identify what are the challenges are. Based on the challenges, just develop the projects. Okay, what are the outcome of this current technology? Benefit of smart healthcare systems. What are the energy outcome? Earlier and accurate disease predictions, packages and remote patient care, reduce healthcare costs. Okay, reduce the health costs. Okay, and then improve treatment accuracy and patient recovery, more efficient and accessible to remote places. So more service applications we can able to. What is this? Hello guys, what is this? What is the first one? Second one, heartbeat. Okay. Third one, first one, what is the second one? What is the third one? Have you seen this type of devices? Have you seen? It's wearable devices. In the first slide, we discussed wearable devices, right? Yes. So this device also is going to analyze each and every day what like smart ones you are wearing. So this device also analyzing all the data about the human bodies. Fine. The second one, what is the second one? What is the second one? Yeah, everyone have seen. Everyone knows that devices. Please look at D. What is the second device? What is the second device? Stethoscope. Latest stethoscope. What is that? Latest stethoscope. The stethoscope will indicate heartbeat. Stethoscope. So usually you have seen that stethoscope is normal, correct? The stethoscope is updated. So similarly, what are the devices you are using currently? The devices future is going to update into integrate into AI and IoT. Fine. Third one, facial yes conditions. Okay, skin conditions will be displayed. What about your skin condition units? Okay. Okay. The next one, wearable health sensors. Wearable health sensor means what? Watch Fitbit, monitor heart rate, EGC, SP2O in real times. And smart medical equipment. A stethoscope detect heart problems. Okay, instantly. So the stethoscope is going to immediately respond and identify your heart problems. Fine. And then Another one is AI-based diagnostic systems. AI-based diagnosis system. Okay, that is an app. It's an applications. When you are going to show your face, applications is going to identify your skin cancer on the spot. Okay, using photos. And then telemedicine also is available. Okay, telemedicine. Okay, then video consultation and remote care. What are the current outcome? Current technology outcome. What are the current technology outcome? Wearable devices, smart equipment. Okay, all the devices. For example, earlier you want to know about my heartbeat or the heart rate. When you are going to do you are see the doctor. This is the heart rate. First, I need to get the appointment. Then I need to meet the doctor. They will be checking. Now, no need to visit the hospital. What device you can you are wearing smartwatch or smart wearable devices. Okay, the magnetic device you are wearing automatically will be display all the data. That is the improvement of technology. What about next 5 to 20 years? What about next 5 to 20 year plans? Okay. The 5 to 20 year, 5 years, the 5 to 20 years. Really helps predict decision earlier. If we use it time, we will find out early. So, personalized health habits. So, automatically, going to, for example, your brain, for example, you are not feeling good. Your brain will be inform you, correct? Your body will be feeling one, sneezing, coughing. So these things are so you are going to affect the fine. The next 10 years. What about the healthcare department next to 10 years? Hospitals use smart devices. Thereafter, all the hospitals will be using the smart devices. Fine. To automate patient monitoring and to improve cash speed. So, automatically patient monitoring to improve the patient's mood. So, from hospital will be okay, they will be take the patient information. The next 15 years. Personalized treatments based on genetic become common, improving recovery needs. The genetics problems, okay, control them will be improved. Next 20 years. See, after these things will completed, we are going to create with global. We are going to share our globally. Global healthcare is worldwide itself. So, what is the future outcome of? So, previously we discussed the outcome. This is the future. What is the future outcome? Early disease detections. Efficient hospitals, few errors. Hospital never do any errors. Personalized treatment. When you're going to put it in a hospital, the treatment should be very clear. And global fast healthcare access. Every day, from everywhere can be access. Fine. Yeah. See this herbals. Do you know this herbals? Have you seen this herbals? What is this name of the herbals? Okay, in your daily routine life, what are the herbals you are using? Correct. In your daily routine life, what are the herbals you are using? Yes. Any idea? We are using our herbal, correct? Tulasi, very good. see rasam. When you are going to prepare the rasam, you are using one leaf. What are the leaf name? Two leaf, correct? What are the name? Two leaf. Leaf. Okay. Okay. Two leaf. Totally Bangalore. Yes. Bangalore is you know, but you go to the correct? Using that weapon, actually currency. So everyday life, you are using the currencies. You must services. Then any AI technology or IoT devices, okay, connected with converse. All of you please listen. Is there any? The first one, it is a for example, snake, if it is snake is biting, okay, if you are making this leaf juice, okay, automatically the snake poison will be goes to outside from your body. That's the first leaf. And then another one, suppose you have sneezing, coughing, okay, that leaf just water. Sorry? So that's not even not effective. Leaf what it okay, automatically the sneezing is gone. Sneezing is gone in your mind, your body. So these two leaves is very very important. Not only these two leaves. Okay. So herbal is very very important. Is there any medicine correct? All the herbals mainly we are using for actually products, right? The products comes from the this type of herbals, correct? Only everything comes from the herbals only. Right? So herbals is there any herbals connected with trade transfer? Yes. Siddha, Ayurveda, medicines we are using, correct? Ayurvedic, okay, Unani, homeopathy. So what different type of medicines we are using comes from the herbals. Is there any technology connected to AI? Is there any forms, herbal forms connected to AI? AI? Right. Sorry, a song. That is coffee. I'm asking about this medicines oriented thing. Herbals. Coffee, they will coffee tea leaf is okay. We are daily consuming that. This is well, now we are discussing healthcare department. So the healthcare is very very important. Is it pops? I never seen guys. I never seen any herbal forms connected to through a concept. You can implement a project through area. This area is very very important area also. Fine. Okay. Herbal productions in current technology. What are the technology we are using? Okay. Soil and climate sensor. Okay. We are using the soil and climate sensor. Okay. The aim is to plant health monitoring. Okay. Smart irrigation system. Digital supply tracking. What is the outcome of current technology? 30% increase herbal crop yield. Okay, sorry, 20 to 30 percentage increase in the herbal crop. 40 to 50 reduction in the water usage. So we are reducing the water usage. How much? 40 to 50 percentage. Early disease detections with over 90% accuracy. The current technology has to 90% accuracy. Okay. Early disease means what? The herbal, if it is affected by any disease, regular disease. Okay. Human one. Low emission from fertilizers and pesticides. So, minimal usage. Which one? Pesticides. Which one? Fertilizers. Okay. Improve product traceability and consumer taste. Okay. What are the natural products are available? Example, what are the natural products are available in medical cosmetics? All the cosmetics are manufactured by chemicals, right? All the cosmetics items. All the tablets, all the products, they are manufacturing from the chemicals only. So that is very, very important. What about the plan? 5 to 28 plan. What about the next plan? The future. The first one, 5 years. Will optimize herbal cultivations. So we need to implement this. See guys, this is the third area. Okay, this is very, very important. Okay, nobody never care about this new concept of plants. Which one? Herbals. Okay. They optimize the herbal cultivation. Use advanced AI to tailor plant nutrition management and climate response for each herbal spices. So we need to focus on the full A concept. That's the 5 A's. Automated harvesting system. Okay. After cultivation, we are going to harvesting. The answer two A's. So we discuss one row is going to plug the which one fruits, right? Yes. A is. Similarly, robotic harvesters to pick ancient medicinal plants with precision and speed. Quality predictions using AI. Okay, after cultivation is working, after harvesting is you are going to check the quality, how much this apple comes to society. Okay, how much can able to produce products? How much can able to produce chocolate? Okay, how much minerals is contained, vitamins is contained. Those points we can easily predict by using AI. Right? Quality predictions using AI. Three models forecast herbal compound production and quality before the harvest, improving product consistency. So it helps to improve the quality. Next one, global herbal supply chain expert. So having, if we are having a strong productivity, we have very good quality herbals, we can export to the outside the world. That is a network supply. Integrated digital platforms with a seamless, transparent flow of across markets. Okay, which herbal high cost? Is there any idea, guys? Which herbal is high cost? Do you know? Any idea? Is there any idea about which herbals high cost? Sorry? Which herbal is high cost? Any idea about that? No, you don't know. Sandalwood. Redwood. Redwood. Saffron. Saffron is on the east coast. How much actually? I don't know. You don't like? Oh, okay. I don't exactly. You know the Kummapu, Kummapu, here is a place. Is available easily. Is high cost. Okay. This is hyper productions. Next one, 5 to 38 grams. For the future impact. Suppose if you are using A concept, what is the future? High production efficiency with less manual labor. They are going to implement A concept automatically, the labor cost will be reduced. Consistent, high quality, and products. So, consistency in the produce more quality hybrid products. First, access to global markets. We can easily export to the global markets. We can easily export to the global markets. Sustainable. So we can maintain the sustainability. Data-driven decision making for products. So we can maintain the sustainability. Sustainability is very, very important. Okay, these are the future. The next topic. The next topic, doctor identifications. What you are going to do? Suppose you are working in remote place, maybe other state. Suppose you are not feeling well. What you are going to do? You are going to search the doctors, nearby doctors, nearby clinics. In Google, you are going to search it. You are going to search it. What will happen? The Google gives you some data. Google gives you some data. Who are enrolled in the legal some pages. Okay. Will be coming for over first students. Right? This will be a the selection to a all the doctor is yes. All is okay. Yes. Whatever the doctor expert gives us. What is the current technology? Online doctor databases. So we are going to link the doctor databases to online. Okay. Platform is qualified medical experts with special contact information and credentials. So these informations are available usually online databases. Daily basic analysis. Algorithm analyze doctor performance. How? See, some people you are, for example, you are going to chasing one product from Bain, Amazon or Flipkart. What will happen on Bain? You have some games, right? After you're traveling from somewhere else, okay, the people in this gives you your ratings. So the algorithms analyze doctor performance, okay, experience, and patient's outcomes, okay, to get a reliable data. Okay, so A is so algorithm. How many algorithms you know? Algorithms. Do you have any idea about algorithms? What are the algorithms are there? See guys, when you are going to attend the interview in final semesters or third semesters, they will be asking the questions from algorithms only. So A algorithms, okay, is specialized. It is going to analyze the input data. Here, what are the input data is going to take a performance, doctor performance. Second one, experience. Then another one, patient outcomes. The patients also give some ratings, inputs. Something reliable ratings. Next one, digital patients rating. Digital patients rating. Real patient feedback on treatment experiences helps others choose the right sport. Okay. It gives to you, it helps to you. You can choose the who is expert on this particular places, particular disease. For example, heart problem is there. You want to heart expert, you want to do thing. So that helps to you. Teleconsultations platform. Okay. Video based. Okay, doctors maybe the experts will be coming and talk discussing about problems. Okay. Video and short explanations, clarifications with specifics, regardless of notices. The doctors will be moving immediately or once they will be go to from one district to another district, they will be do consultations. The expert people will go for will are moving the another places from one district to another places. Okay, so these are different technology helps to identify the doctor expert. Okay, what about in future? What about in your future? How you are going to or improving or totally you are going to connect to they will be false. That's definitely yours. This is the current technology outcomes. The simple outcome, first one, easier access to verified doctors' profiles. Okay, easily profiles and smart and data-driven doctor selections. Seriously, select the doctors. Increase the patient confidence and transparency. Okay. Transparency level also will be increasing. Remote expert institutions from you. Okay. Very much. Next one. What about the next one? 5 years, 10 years, or 15 years, 20 years. What about the this technology is going to change? Only next 20 years, change. Right. AI-based doctor patient systems. Okay. So AI-based doctor patient systems. Maybe you can create one doctor patients. Okay. Advanced AI will match patients with most frequent doctors based on the symptoms, state, price. So these are the items. Skill-based expert identifications. Maybe the doctor is on the skills. Maybe some people are going to do general medicines. Okay, they never do any surgery. Some doctors only they do surgery. They never go with the normal medicines. Okay, they never practice on normal things. The expert only they are doing for only one. They never do it in one. Fine. Look at the skill base. Doctors implement by proven skills, treatment outcomes. I go to this doctor successfully cure my issues, cure my problems. So, yeah, things. So, treatment outcome. Specialization rather than just instance, rather than just instance. Global doctor once. Globally, the doctor once. Seamless international platforms will connect patients with all medical experts worldwide. Okay. So some people are going to wait the treatment foreign countries, correct? Who are rich, they will go to foreign countries. Real-time performance analysis. So real-time performance analysis. Continuous analysis of treatment such as patient feedback and outcomes to improve quality. So these are the next upcoming technology we are going to implement where AI they would be implemented. Fine. What is the future of or future industry? If you are implementing this technology, what is the future? Faster, always faster. Okay, more accurate expert selection. Personalized and outcomes to the indicator. Equal access global medical. Okay, we can get global consultations from your home. Higher transparency and trust in medical services. Full transparency. The medical services will become a transparency services. Okay. Okay. Guys, all of you understand? Yeah. What is the next one? Emergency care. Okay. In emergency care, how we can implement, how we can integrate A and IoT. Any idea? Emergency care. smart ambulance. So we can create a smart ambulance. So with these, look at the ambulance, what are the benefits, what are the facilities are there. We can improve the some extra benefits. How we can integrate, how we can additionally implement some advanced feature in that ambulance. Please look at it. Smart ambulance. So taking onboard diagnostics, alien answer navigation, real from data side, information for GPS tracking system. GPS tracking system. Land location tracking ensures the fastest route and better coordination with emergency teams. So they can connect with the emergency team. Okay, for example, the accidents will be happening. Okay, the ambulance will be connected to GPS company. Okay, the distance. Right. Okay, how much kilometers from the ambulance to hospitals. So the ambulance can teams will be it will be more the remote vital monitoring. Patients like heart rate, oxygen, BP, and etc. Are monitored and transmitted to doctors before hospital arrivals. So before the patient is going to get into the hospital, all the data will be sent to the hospitals. Emergency alert apps. Mobile apps send instant alerts to ambulance, hospitals, and emergency contacts. If any accidents happen, so it will be alert to the nearby where hospitals. Okay, the hospital immediately they will be communicating and thanks to the ambulance. What is the outcome of current technology? What is the outcome of technology? Faster emergency response times. Faster. Always, when you are going to higher technology, when you are going to enhance the technology, always we can achieve the faster. Improve survival and story lives. Recover the coordination between patients and hospitals. The coordination, hospitals and patients. The next 5 years plans. Alright, this is important. Earlier we discussed current technology. This one is next 5 to 20 years plan. Okay. In predicted emergencies. So who is going to predict the emergency? Emergency level. What's the medium level or going to predict? AI system analysis and data patterns to predict medical emergencies before they occur. Autonomous emergency vehicle. Okay. Autonomous emergency vehicle. Smart traffic management. Okay, the ambulance is coming. The traffic is big issue, correct? The traffic is a big issue. We need to maintain the traffic management. Instant hospital, which one? Prepare. So instant things we need to prepare systemly inside the hospital for the patients. Fine. Self-driving ambulance will reduce the response time and operate continuously without human delay. Have you seen self-driving cars? In India is there self-driving car. Have you traveled? No. Self-driving cars. Have you seen self-driving cars? Maybe you see some which stay video, DVP. Yeah. Self-driving cars is the but yeah, already implemented. Similarly, self-driving ambulance. Similarly, AI-based self-driving ambulance, how we can implement. And then smart traffic management. See, populations always will be increasing, never reduce. All of you listen. Population always will be increasing, never reduce. So the traffic is the big challenge for the one. Okay, metropolitan city or for cosmopolitan city, the traffic is big challenge. Okay, so smart traffic, all control traffic signals automatically create rules for emergency maintenance. And then instance, hospital preparedness. Hospital receive real-time patient data, prepare stock, equipments, and beds before arrival. Before the patient enter into the hospital, okay. So lot of things they need to prepare. Okay. What about future impact? Suppose if you are implementing these things, what is the outcome of future? Prevention and early intervention of emergency. Near zero response delays. Higher survival rates. So your survival rates will be increasing. Fully synchronized emergency ecosystems. Fully synchronized ecosystems. Fine. The next challenge. The next biggest challenge, medical wastage. How we can dispose the medical wastage. What is the current technology? What is the current technology? So the 12 o'clock or 1 o'clock, Telangana government is going to dispose to the Andhra Pradesh. Andhra Pradesh government, the driver will be, and then again comes to the Telangana state and will be disposed to the places. Correct? They are collecting all the medical wastage. This things depend all the border. The state border will be happening. Okay, Tamil Nadu people will be goes and deposited to Andhra Pradesh. Andhra Pradesh people will be deposited to Tamil Nadu location. Kerala people comes to the Tamil Nadu, and then Kannada people also comes to the Tamil Nadu. This is the current technology they are disposing the medical wastage. This is the biggest challenge. See, you can invent how to dispose the medical wastage. This is the big, not only in India, all over the world, they are facing big issue. They don't know how to dispose the medical normal wastage, routine wastage, we can dispose it. But medical wastage, government, they don't have the proper plan. They don't know how to digest all those things. It's the biggest challenges. Not only in India, all over the world, all the government, okay, all the state governments, all the countries there, they don't know how to dispose properly. It's the biggest challenges. Fine. Waste tracking sensor. Okay, waste tracking sensor. Sensor is there. Sensor medical waste quantity, time, and movement in the real time. The digital waste records. Electronics, electronic logs record waste information. How much waste is there? Okay. Storage and disposal details. Automated segregation systems. Machine-based storing, and machine-based sorting separates biomedical waste accurately and safely. So lot of expenses has from global use, a lot of expenses is happening. Like monitoring tool, digital platforms, Excel, internet to medical waste in science. So these are the things are current technology they are using. Maximum they are using the sensor. Sensor. Okay, much kg is there? How much time is there? What is the outcome of current technology? Improved waste handling accuracy, reduce the environment and health risk, and better regulatory compliance, increase transparency and affordability. These things you can say in reality, the government is they don't know how to dispose of all the medical wastage. So you are a student, can do the projects how to dispose the medical wastage. So in the North India, the agriculture based what they are doing simply 25 fully the smoke will be surrounding the environment. Pollutions they created. Right. From that wastage also we can do many things. Okay. For example, the leaf, no? The leaf only they finally the things are like the leaf. You can collect the leaf, most of the leaves, finally you can put it plants for these vegetables. You can prepare it, you can make it some wrap papers. Correct? I don't know why they are not doing well. They are not what you right. We didn't play the policy fully on the spot. Fine. Similarly, you can find solution for medical waste. How to give the solutions by using AI and IoT devices. Okay. Waste tracking sensors. Sorry, this is not this one. Fine. Next one, consultation management. Consultation management. Every doctor will be first morning will be giving medicine or not. The consultation fees. How much they are asking? Is your 600. 600. 600 they are asking? No. 200 they are. 200. Okay. Minimum, maybe they will be asking. Yes. You will have a normal fever if you are going to meet the doctor. Maybe they will be asking. Medical medicine charges is extra. Right? Apart from the consultation, medicine charges is extra. Okay. How you are going to consultation comes under the how you are going to bring into the body devices. How you are going to implement a concept. Okay. Now, what is the technology we are using? Online payment systems. Which one? You know, UPI, cards, mobile wallets, digital billing platforms, automated billing systems, generate invoices, and digital payment records, standard fee databases, teleconsultation pricings. So these are all the consulting fees, current technology. What is the outcome? Faster and cashless transactions, transparency, reduce billing errors, improve patient convenience and trust. What about the next plan? What about the next plan? 5 years, 20 years, 10 years, and 15 years. A-based fair pricing. For example, you are creating any place. For example, village means this is the picture. Yes. So the doctor never asks more prices, right? They never ask more and more. Consultation fee. They will determine pay consultation fees based on expertise, outcome, demand, and affordability. Dynamic fee regulation. Real-time regulation adjusts the fees according to the location, urgency, healthcare, access, needs. Transparent billing system. Fully digital. If you are implementing is fully digital, if my billing visible to patients before consultations. Everything is digital, it means okay. It means okay. Digital about before the doctor before the consultations. Maybe the after consultations, maybe the doctor the fees will be changing. For example, he is going to meet the doctor. The doctor will be asking to me, okay, 200, okay. Next person is going to meet the doctor. Oh, give me 300. Dynamically, the doctor may be charging. These possibilities are so we can avoid that dynamic situations. Global healthcare pricing models. We are going to company in the global funds. Standardized international pricing frameworks for cross borders and virtual consultations. From one country to another country, who are ready to come and concern. They can also easily, visibly information channels. These are the future impact. These are the future impact. When you are going to go with IoT, what are the future impact? Fair and civil consultations, reduce the pricing disputes. Okay, I told you know the pricing disputes. For example, this person and that policy. Increase trust, credit payments, seamless global healthcare access. Okay, seamless global healthcare access. From the globally, we want to be able to access. Over next one, medicine. Medicine cost is too much cost, right? They will give you two tablets. How much they are asking? For example, if you are going to ask the medical, I have a cold and cough, and if you will fever, how much they will be asking? For two or three tablets, they will give to you. But how much they will be asking? 100. Next to two tablets, 100 rupees. Very good. So, two tablets, 100 rupees. They will give you two sets, maximum two or three tablets. They will ask you 100 rupees. So, how we are going to, okay, medicine price regulations. How we are going to do? Do you know the exact price of the medicines, all the tablets, tonics, ointment? Do you know exact price? You don't know the exact price. It's very less cost. Generics medicines came no right now. They are giving very less cost. You can go and buy one small tonic. Okay, for example, which one? Some syrup or any iron tonic if you're going to buy. Okay, for example, zinc tonic. Okay, zinc. Okay, zinc tonic if you're going to buy maximum 40 rupees or 35 rupees, 35 to 40 rupees only they are asking. Same tonic, just go to ask another medical. Minimum 110. Minimum 110. Minimum 110 they will be charging you. How much difference is coming? Around 70 rupees. Okay. You just imagine you will become a big rich. Correct? Here, again become a very poor. So, how we are going to control? Okay, what are the current technology we are using to predict the prices? Medicine prices. Digital price monitoring. Online systems track medicine prices across regions and suppliers in real time. Online pharmacy platforms. Nowadays, online pharmacy also key. You can order in the online portal, even from your home. Else, you need to go to medicals or you need to go to doctors. Fine. Government price database. Official portals, portals regulating medicine prices to prevent over supply chain tracking. Digital tracking monitors. Digital tracking monitors medicine movement from manufacturer to retail. Okay, these are all things. Current technology we are using right now. What is the outcome of this technology? Improved price, transparency, reduced overpricing of fraud, yeah, increased patience, affordability. Yes. Fine. How we are going to use in the next step? Yeah. Next step, why to MTS plan. How we are going to implement. So guys, what the design here very very important. AI controlled pricing system. So we can connect with AI. Normal pricing systems are available. Pricing system you are going to connect with AI based. AI will set fair medicines prices based on production cost. and demand and public health needs. Real-time markets regulations. So real-time market regulations. Every day the price will be changing. Continuous monitoring will prevent sudden price hikes. Okay, and shortages. So A will be analyze the hikes and shortages. Fine. Fraud prevention systems. Advanced digital verifications. If I have advanced verification systems, no one able to do any frauds. That verification system will stop counterfeits and illegally priced medicines and affordable medicine access. Global platforms will ensure essential medicines remain affordable for all populations. These are the next step 5 to 20 years plans. You also coordinate. What is the impact? Suppose if your future 5 to 20 years plans you are implementing, what is the outcome of the future? Future impact. Stable and fair medicine pricing. Elimination of counterfeit drugs and improved medicines availability. Stronger public trust in health system. So public means what? We are all the publics, right? We can trust the our government health system, public health systems. What is the next one? Drugs. Okay. All the things are happen illegally, right? What are the drugs are there? Lot of things are there. But anyhow, we are going to all the hall and so many things are there, right? So how we are going to control these things? Barcode and QR tracking. What is the current technology we are using? Barcode and QR tracking, digital drug approval systems, tools effect monitoring, counterfeit drug elections. So these are all the currently using this technology. Okay, with government approval, you are using this now. So government has to come and then safer drug supply chain. Faster regulatory approvals. Only drugs are less cases of cases. Okay, our counterfeit medicines. We are going to reduce the circulation of counterfeit. Next. So this also you can integrate with A based and IoT based medicines. Fine. A based drug safety analysis. A based safety analysis. Smart regulatory systems. Global drug monitoring. Automated recalls. See, each and every technology will get more benefits. In the first one, AI based drug safety analysis. AI will predict what is the of side effects and interactions before drugs reach the markets. So AI will be the surveillance. Fine. Smart regulatory systems. Automated platforms will streamline approvals. Automated platforms okay, will streamline approvals, compliance, check, and policy data. So the policy will be clear. Policy means the rules and regulations. Right? How much can you do? Global threat monitoring. International networks to track safety, distributions, and quality in real time. Automated inputs. AI system will instantly identify unsafe batches. So automatically you can identify the unsafe batches. Okay, and initiate recalls worldwide. And initiate the recalls worldwide. What is the future impact? So implementing this thing, what are the benefit realizations? What is the next one? What is this next one? Counseling center. Right? We have the session center, counseling. Counseling center is available in Hyderabad. Yeah. Counseling center also we can connect with our AI technology. Counseling center is very, very important. Nowadays, nowadays, which counseling is important? Mobile addiction, right? Nowadays, people are addicted by mobile. So mobile rehabilitation center definitely are telling they will be somewhere. Nowadays, you can look at the school children. Frequently, they are using the mobile, right? Continuously, they are using the mobile. Automatically, their eyes will be affected. They are wearing specs. Even 5 years, small child, they are wearing the specs. Fine. Similarly, rehabilitation. So, AIs. What are the current technology we are using the rehabilitation sector? Wearable rehab devices, sensors and exoskeletons. Exoskeletons track patient movements and facilitate exercise. So that device helps to the some exercise. Suppose if you are not doing any exercise on regularly, it will be remaining. So you are missing this exercise today. A therapy planning. A analysis patient conditions, customized therapy, routines for faster recovery. Remote progress tracking. Remote progress tracking. Mobile apps or cloud platform monitor patients' improvements in real time. Ritual rehab sessions. Video based. Video based or virtual reality based. Okay, allowing patients to continue rehab. Okay, or from the home. Some patients want to be rehabilitation center. So, through video call from virtual reality, they can take care the rehabilitation. Fine. What is the outcome of this one? Personalized and efficient rehabilitation, continuous monitoring outside the clinic, faster recovery, great patients engagement and other. So these are all the current outcome of this key. What about next 5 to 20 years plans? What about the next 5 to 20 years plans? Now they are using video conference or virtual reality. Okay. From the home, you can automate this one. Home based for rehabilitation. Home based automation. Faster, right? Foundation sensor will data will be sent to the patient details from home to hospital. Similarly, this also well, we can continue. A is robotic physical change. Thereafter, sorry, therapy. So thereafter, therapy used to be to robot. The robot is used to like the massage, right? Next one. What is the impact of future? Highly personalized efficient rehabilitation, reduce the hospital visits, faster and safe recovery, greater patient independence and engagement. Fine. I'll just stop. The sharp one, link. Okay. All of you please create that link. So link that you have to turn the thousand experience to offer. Mobile is not an option. Okay.